Now, despite the millions of lives the COVID vaccine ultimately saved and continues to save, as the pandemic broke out, there was a very noticeable decline in children getting vaccinated for measles, from about 97% in 2020 to 94% last year. That's according to the CDC.
Now, hundreds of people, mostly in the Southwest right now, have contracted the virus. There's at least one case in Vermont. As News Cinemain's Raya Wooten reports, doctors say there is something that links the two.
The cough, red eyes, and the key indicator, a rash.
I really thought that and hoped that I would never see measles.
Maine Health's Dr. Dora Mills first saw measles outbreaks early in her career when she worked in Tanzania, then again in the early 90s during America's national measles outbreak. But then the potentially deadly disease was eradicated in the U.S. in the year 2000.
And I was just shocked to see it. And
Dr. Mills is stunned to see it return. 25 years later, new cases have spread as far north as Alaska, as far south as Florida, even hitting northern New England with at least one case now confirmed in Vermont. Measles outbreaks in Texas and New Mexico are growing, with an unvaccinated child dying in Texas and an unvaccinated adult in New Mexico also dead.
the tragedy to me is that this outbreak is primarily, entirely due to people not getting vaccinated. We've had just an epidemic of misinformation, and people are afraid of vaccines. Some people are afraid of vaccines, and yet it's one of the biggest public health achievements of the 20th century.
The World Health Organization and the CDC both say that if you have measles, you could potentially infect 9 out of 10 people that you come in close contact with.
The key thing you can do to prevent measles is to get vaccinated. Unfortunately, there isn't really anything else when it comes to an airborne virus that you can really do.
Doctors say without vaccination, the risks are high. In Portland, Raya Wooten, News Center, Maine.
Now, Maine passed laws in 2020 that require parents to vaccinate their children before enrolling them in school, resulting in higher vaccination rates when compared to other states.